Morning everyone, bonjour à tous. Je suis heureux d'être ici aujourd'hui avec la vice-première ministre Freeland, la ministre Anand, ainsi que la docteure Tam et le docteur New. Alors qu'on lutte contre cette troisième vague, notre priorité absolue continue d'être la sécurité de tous. Hier, on a tenu notre 30e rencontre des premiers ministres des provinces et des territoires depuis le début de la pandémie. Le message pour les premiers ministres a été clair. Le gouvernement fédéral est là pour vous appuyer. Yesterday, the premiers and I had another productive meeting. We talked about vaccines, testing, and what we can do to beat this third wave. We also talked at length about borders. Premier Ford asked that we suspend the arrival of international students. Because at this time, Ontario is the only province requesting this, we're happy to work more narrowly with them. We'll be reaching out to their officials today to formalize that request. Again, I want to be clear. This is not the time to travel. On land borders, as a reminder, anyone who comes to the U.S. land border has already been tested in the U.S. in the last 3 days. Then they have to get tested again. And everyone has to quarantine for 2 weeks and do another test on day 8. We're enforcing very severe consequences for anyone breaking these rules. Yesterday, in addition to all this, Deputy Prime Minister Freeland provided an update on the budget as well. I also took the opportunity to congratulate Premier Silver of Yukon on his re-election. I look forward to continuing to work with him on everything from the fight against climate change and creating affordable childcare to our commitment on building a stronger relationship with Indigenous peoples. In fact, I'll be calling Sandy later today so we can discuss these priorities further. As I told everyone around the table last night, it's vital that we keep working together. We're following the situation with this third wave closely, especially in places that are hardest hit. Yesterday, Alberta reported their highest single-day total since the beginning of the pandemic. Premier Kenney announced new restrictions to slow the spread of the virus, and our government is ready to work with the province to provide support. For Ontario, medical teams from the Canadian Armed Forces began arriving in Toronto on Tuesday night, including critical care nurses who will work in the ICUs. This first deployment of 55 members of the forces will be providing assistance to Sunnybrook Hospital and its mobile units. On Tuesday as well, a healthcare team from Newfoundland and Labrador arrived in Ontario. They're helping at Toronto General Hospital. Like I said before, we are actively working with the Government of Ontario to determine how else we can support them. For Nova Scotia, where cases are also high, we've deployed 60 Canadian Armed Forces members to testing centres to help stop the spread of the virus. And for New Brunswick, we've approved the province's request for assistance for long-term care homes. The Red Cross will assist in up to 3 facilities until the end of June. Nunavut has also requested additional support to deal with their current outbreaks. We're moving quickly to keep people safe by sending more PPE and health equipment and by providing support for households in isolation who need food or mental health services. We're also engaging with other provinces that are hit hard by this third wave to see how we can help. We're ready to send any resources needed to protect you and your family. And of course, we're continuing to deliver PPE, rapid tests, and vaccines. So far, we've distributed more than 15 million doses of vaccines right across the country. Wednesday, almost 1 million doses arrived in Canada, including our first shipment of the single-dose Janssen vaccine. Starting next week, we will be receiving 2 million doses a week just from Pfizer alone. This will mark another major ramp-up. We will continue to work with provinces and territories to get these doses to Canadians as quickly as possible. Il y a de plus en plus de gens vaccinés. Dans plusieurs provinces, la vaccination sera ouverte à la population générale très bientôt. C'est une nouvelle encourageante. Au cours de la dernière année, on a souvent répété que chaque effort compte. Chaque effort aide à protéger nos travailleurs de la santé, nos familles, nos voisins et tous les Canadiens. En portant un masque, En
wearing a
gardant nos
mask, by
distances, en
maintaining
restant à la
social
maison,
distancing, by staying
on
home,
aide à
we
sauver des
help
vies.
save lives.
Et c'est vrai aussi
And it is
de se
also
faire
true
vacciner.
with respect to
Chaque dose de
vaccinations.
vaccin
Each vaccine
compte.
dose counts.
Aussitôt que c'est votre tour,
As soon as
je
it's
vous
your turn,
encourage à
urge you
prendre un rendez-vous
to take
pour
an
recevoir
appointment
votre
to
vaccin.
get your
C'est
vaccine.
important pour se
It's
protéger
important
soi-même
to protect
et pour
oneself
protéger
and
les
to
autres.
protect others.
Et c'est seulement en se faisant
And it's
vacciner
only by getting
qu'on va
vaccinated
pouvoir passer à
that we'll be
travers
able to get through
cette pandémie et
this
revenir
pandemic
un peu à la vie qu'on
and
avait
get
avant.
back somewhat to the
Au début de cette
lives
crise,
we used to
on a
have.
promis aux
At the
familles,
beginning of the
aux travailleurs
crisis,
et aux
we
petites
promised
entreprises
families,
que notre
workers, and small
gouvernement
businesses
va
that
être
our
là pour
government
eux.
would be there for
On
them.
met tout en place
We are
pour que
doing
notre relance
everything
économique soit la plus
possible to
robuste
make sure
et
that our
rapide possible.
economic recovery is as robust and swift
Just a
as
few minutes
possible.
ago, Finance Minister Freeland introduced the Budget Implementation Act in the House of Commons. This is the next step forward on the plan we laid out in last week's budget, a plan to get through the pandemic, create jobs, and make sure our economy comes roaring back. This bill includes extensions of support programs that have been a lifeline for millions of Canadians, from the wage subsidy and the rent subsidy to the Canada Recovery Benefit and the Recovery Caregiving Benefit. We're facing a very serious third wave, so we need to make sure we can deliver support to the workers and businesses who rely on these programs. Of course, that's not all this plan lays out. With this legislation, we're also setting the foundation for strong economic growth, with funding for early learning and childcare, support for students, a $15 federal minimum wage, and much more. I'll let the Finance Minister go into more detail in a moment, but here's the bottom line. These measures will help you get through what is hopefully the last stretch of this pandemic. This is about how we set ourselves up for a stronger, faster recovery that includes everyone. So all parties need to work together to get this support through the House of Commons to Canadians as soon as possible. En terminant, tel qu'annoncé ce matin, je tiens à souligner qu'Isabelle Hudon, actuellement ambassadrice du Canada en France, a accepté de devenir la prochaine PDG de la Banque des entrepreneurs du Canada, soit la BDC. Sa feuille de route dans le milieu des affaires, autant au Canada qu'à l'international, fait d'elle la personne idéale pour ce rôle. Elle sera la première femme à la tête de la BDC et pourra poursuivre leur travail essentiel pour la relance économique afin d'aider la croissance de nos PME. Dans son rôle actuel, l'ambassadrice Hudon a su mener de nombreuses initiatives de diplomatie économique et, entre 2017 et 2020, les échanges commerciaux entre le Canada et la France ont connu une hausse de 30%. Our fight against COVID is not over yet, but there's reason to hope. With more people getting their shot and more vaccines on the way, we will get through this. And as we do, we're going to keep working together to rebuild a safer, healthier Canada and a stronger, more resilient economy that leaves no one behind. Before I pass it over to Deputy Prime Minister Freeland, I want to extend my deepest condolences to the families, friends, and victims of the tragedy at Mount Meron. Canada stands with the people of Israel and the Jewish community. Merci. Christian.
OK. Merci, Monsieur le Premier ministre.
Thank you, Prime Minister.
Aujourd'hui, j'aimerais répéter certains des principaux
I'd like
piliers
to
du budget
repeat some
de
of the main
2021
pillars
et certains
in Budget
aspects
2021
où le projet
and
de
some
loi
aspects
C30
of Bill
permettra
C30
d'aider
that will
concrètement les gens dans
provide
ce
practical
qui est
help
en cours pour beaucoup trop de
in
Canadiens,
what is
une
still,
période
for far too many
d'inquiétude et
Canadians, a period
d'épreuve.
of worry and
Parce
hardship.
qu'il ne faut pas se tromper.
Make no
Même
mistake,
avec nos efforts soutenus,
despite our sustained
même
efforts,
avec le progrès
despite
de la
the
vaccination,
progress
la
with
COVID
respect to
est
vaccines,
encore
COVID
là.
is still here.
Et la troisième vague
The
est
third wave
encore
is
là.
still here.
Par conséquent, la
Therefore,
nécessité d'adopter ces mesures
passing these
législatives est urgente.
legislative measures is an urgent
When fully
necessity.
enacted, this budget will create, in total, nearly 500,000 new training and work opportunities for Canadians. We're making a historic commitment to early learning and childcare. $30 billion over 5 years, reaching $9.2 billion every year in permanent investments. Within 5 years, families everywhere across Canada should have access to high-quality childcare for an average of $10 a day. Et je veux encore une fois remercier le Québec pour son leadership et surtout les féministes du Québec pour son leadership en ce qui concerne un système de garderie. This budget invests $5.7 billion over 5 years in Canada's young people, doubling the Canada Student Grant for 2 additional years and extending the waiver of interest payments on federal student loans through March of 2023. More than 350,000 low-income student borrowers will have access to more generous repayment assistance. Nous proposons d'élargir l'allocation canadienne pour les travailleurs et investir 8,9 milliards de dollars sur 6 ans en soutien supplémentaire aux travailleurs à faible revenu. Cela offrira un complément salarial à environ 1 million de Canadiens supplémentaires et sortira près de 100 000 personnes de la pauvreté. De plus, le budget instaurera un salaire horaire minimal fédéral de $15. To help small businesses recover and grow, this budget contains a new Canada Recovery Hiring Program that will run from June to November and provide up to $595 million to make it easier for businesses to bring back laid-off workers or to hire new ones. We will also invest up to $4 billion to help up to 160,000 small and medium-sized businesses buy and adopt the new technologies they need to grow and become more productive and more competitive. And will encourage businesses to invest in themselves by allowing for immediate expensing of up to $1.5 million of eligible investments by Canadian-controlled private corporations in each of the next 3 years. These larger deductions will support about 325,000 businesses in making critical investments. Enfin, nous accordons un soutien ciblé aux industries qui ont été le plus durement touchées, soit les secteurs de l'hôtellerie, du tourisme, de la culture et de l'aérospatiale. Nous allons relancer le secteur du tourisme avec un investissement d'1 milliard de dollars. Ceci est en plus de 2 milliards de dollars que nous accordons au secteur aérospatial. Tout simplement, notre priorité est de faire en sorte que les Canadiens puissent retourner au travail. This budget is about growth and about jobs. It's about people. It's about making concrete, targeted investments to heal the wounds of COVID and to put Canada on a long-term track towards higher growth, towards greater prosperity, and towards a clean, green future. The Budget Implementation Act, tabled today, is the first major step in delivering on this plan. As the Prime Minister said, it also includes extensions and expansions of critical COVID-19 support programs for businesses and for people, including the wage subsidy, the rent subsidy, and recovery benefits. These supports are vital, as I have heard in roundtables across the country this week. And these supports will continue to be vital until the virus is beaten. The legislation also takes significant steps to drive future growth, investing in our social infrastructure and our physical infrastructure, in our human capital and in our physical capital. When enacted, this budget will make a measurable difference in the lives of millions of Canadians. I very much hope that our colleagues across the aisle will consider this legislation with the seriousness and indeed the sense of urgency that Canadians need right now. Thank you. Et maintenant, je pense que je donne la parole à nos docteurs. Oui, Monsieur le Premier ministre.
And now does the floor go over to the doctors, Prime Minister? Yes?
Bonjour, bonjour à tous.
Good day, everyone.
This is the end of the National Immunization Awareness Week today. And it's a nice segue into National Physicians Day tomorrow. Not surprisingly, physicians are among the healthcare providers that Canadians trust most for vaccination advice. And during this long and difficult crisis, our debt of gratitude to physicians across Canada extends well beyond. But first, the numbers update. To date, over 1.2 million cases of COVID-19, including 24,169 deaths, have been reported in Canada. We are making progress nationally, but there are still a few tricky spots. Daily case counts have declined by 7% over the past week to an average of below 7,900 cases. Unfortunately, the number of people experiencing severe and critical illness continues to rise. Over the past week, an average of almost 4,400 people with COVID-19 were being treated in our hospitals each day, including over 1,420 people being treated in intensive care units. At the same time, an average of 50 deaths were reported daily. Variants of concern now represent a majority of reported COVID-19 cases, with the B.1.1.7 variant accounting for over 95% of variants sequenced to date. Taking a moment to acknowledge the important work that doctors are doing across Canada and around the world, we're reminded that the statistics we report daily are not just numbers. People who have been infected, those who have become seriously ill, and the families who have mourned a loss have all relied on physicians across the health system to care for and support them. Beyond this, physicians, like others across the healthcare workforce, have continued to provide care under some of the most difficult circumstances imaginable. Some are working tirelessly to provide direct treatment for patients. Others are working despite the challenges of COVID-19 in order to maintain the best level of care for patients in all areas, from emergency medicine to mental health, management of chronic diseases, and prevention programs, including immunization. As we did last year, on this day, we would once again like to acknowledge the leadership and support and dedication of our provincial and territorial colleagues. Working together has made us all stronger in leading Canada through the long and rough terrain of this crisis. We are a country of consensus and collaboration, and this event has required virtually around-the-clock collaboration to assess the evolving science and evidence, provide a vast range of public health advice, and share practical experience at every stage of the response. On behalf of our colleagues, I also want to thank Canadians for their continuing efforts. More than a year ago, when Chief Medical Officers called for massive changes to the everyday lives of Canadians, you rose to the challenge, and you have shown perseverance, kindness, and solidarity. Though we are in a difficult stretch right now, we are making progress. Public health measures having an impact. And with over 13.1 million doses of COVID-19 vaccines administered across Canada to date, and vaccine supplies increasing, we will get to better days ahead. As you continue with individual precautions, follow public health advice, and get vaccinated when your turn comes, please do not stop all the other things that are vital for maintaining your health. Seek immediate care for urgent issues, and keep up with health visits to maintain physical and mental health. Care for chronic diseases, and prevent future problems by keeping up to date with screening and vaccinations. Even after you've received the vaccine, hand washing, physical distancing, and mask wearing remain as important as ever. Thank you for staying as healthy as you can.
Bonjour à toutes et à tous. La fin de la Semaine nationale de promotion de la vaccination aujourd'hui est une belle transition vers la Journée nationale des médecins demain.
leading
Il n'est
into
pas
National
surprenant
Physicians
que les
Day
médecins
tomorrow.
comptent parmi les
Not surprisingly,
prestataires de soins de santé en qui
physicians
les
are
Canadiens
among the
ont le
healthcare
plus
providers
confiance
that
pour des
Canadians trust
conseils sur la
most for
vaccination.
vaccination
Et en
advice.
cette longue et difficile
And during
crise,
this long
nous
and
devons
difficult
bien
crisis,
plus qu'une fière chandelle
our debt
aux
of
médecins
gratitude
partout au
to
Canada.
physicians across Canada
Mais
extends
d'abord,
well
voici les
beyond.
derniers chiffres.
But first,
À
the
ce jour,
numbers
plus
update.
de 1,2 million de cas
To
de
date, over
COVID-19,
1.2 million
dont
cases
plus
of
de 24
COVID-19, including
169 décès, ont été
24,169 deaths,
recensés au
have been
Canada.
reported in Canada.
Nous progressons à l'échelle nationale,
We are making
nationale,
progress
mais il y a
nationally,
encore quelques
but
endroits
there
où
are
la
still a
situation
few
est
tricky
difficile.
spots.
Les comptes quotidiens ont diminué de
Daily case
7%
counts have
au cours des
declined
2
by
dernières semaines
7%
pour
over the
atteindre
last
une
week
moyenne
to an
inférieure
average
à 7
of below
900 cas.
7,900
Malheureusement,
cases.
le nombre de cas
Unfortunately,
graves
the
et
number
critiques
of people
continue de
experiencing
croître.
severe
Au
and
cours de la
critical
dernière
illness
semaine, en
continues to
moyenne,
rise.
presque
Over
4
the past week,
400
an
personnes
average of
atteintes de la
almost
COVID-19 ont
4,400
été
people with
traitées dans nos
COVID-19
hôpitaux
were being
chaque jour,
treated in
dont
our
plus de
hospitals each day,
1420
including
personnes
over
étaient traitées dans des unités de soins
1,420 people
intensifs.
being treated in
Au cours
intensive
de la
care
même
units.
période, en moyenne,
At the same
50
time, an
décès ont
average
été
of 50
recensés
deaths were
chaque
reported
jour.
daily.
La majorité des cas de COVID-19 signalés sont désormais associés aux variants préoccupants.
Variants
Le
of
variant
concern
B117
now represent a majority of
pour plus de
reported COVID-19 cases,
95%
with
des variants
B117
séquencés
variant
à ce jour.
accounting for over
Quand
95%
nous
of
nous
variants
arrêtons un instant
sequenced
pour
to date.
mesurer le travail
Taking a
important
moment
que les
to
médecins
acknowledge the important
accomplissent au
work that
Canada
doctors are
et
doing
dans le
across
monde,
Canada
nous
and
nous
around the
rappelons
world,
que les
we are
statistiques que
reminded
nous publions
that the
quotidiennement
statistics we
ne sont
report
pas
daily
que des chiffres.
are not just numbers.
Les personnes qui ont été infectées,
People
celles
who've
qui
been
sont tombées
infected,
gravement malades
those who
et
have
les
become
familles qui ont
seriously
perdu
ill,
un
and
de
the
leurs
families who have mourned a
ont toutes
loss
compté sur les
have all
médecins,
relied
le
on
système de
physicians
santé pour les
across the health
soigner
system
ou les
to
soutenir.
care for and
En
support
outre,
them.
les médecins, comme
Beyond
d'autres
this,
travailleurs de la
physicians, like
santé,
others
ont
across the healthcare
continué à
workforce,
donner des soins
have
dans
continued
des
to provide
conditions
care
parmi les plus
under
difficiles
some of
que
the
nous
most
puissions
difficult
imaginer.
circumstances imaginable.
Certains d'entre eux travaillent sans relâche pour
Some are
prendre
working
soin
tirelessly to
directement
provide
des patients
direct
atteints de
treatment
la
to patients
COVID-19.
with COVID-19.
D'autres s'efforcent, malgré les
Others are
défis
working,
qui
despite the
présentent
challenges
la
of
COVID-19,
COVID-19,
de maintenir
in
le
order to
meilleur
maintain the
niveau de
best
soins
level of
pour
care
les
for
patients
patients
dans tous les autres
in
secteurs,
all other
de la
areas,
médecine
from
d'urgence à la
emergency
santé
medicine to
mentale,
mental
en
health,
passant par la gestion des maladies
management of
chroniques
chronic
et les programmes
diseases,
de
and
prévention,
prevention
y
programs,
compris
including
l'immunisation.
immunization.
Comme nous l'avons fait l'an dernier, nous aimerions, une fois de
As we did
plus,
last year,
souligner le leadership,
on this
le
day we would
soutien
like
et le
once again
dévouement
to
de
acknowledge
nos
the
collègues des
leadership,
provinces et
support,
des
and
territoires.
dedication of our
Le fait de
provincial and
travailler
territorial colleagues.
ensemble nous a
Working
unis
together
et a
has made us all
renforcé la
stronger in
capacité
leading
du
Canada through
Canada
the long
à
and rough
traverser
terrain
cette crise violente et longue.
of this
Nous
crisis.
sommes un pays de consensus
We
et
are
de
a country of
collaboration.
consensus and
Et pour cet
collaboration,
événement,
and
nous
this
avons dû
event
compter sur une
has
collaboration
required
virtuellement jour et nuit
a
pour
virtually
explorer la
around-the-clock
science en
collaboration
évolution
to assess
et
the evolving
évaluer les
science and
données probantes,
evidence,
donner une
provide
vaste gamme de conseils
a
en
vast
matière
range
de
of
santé
public health
publique et
advice,
transmettre
and share
l'expérience
practical
pratique
experience
tout au long de
at every
l'intervention.
stage of the response.
Au nom de nos collègues, nous
On behalf
tenons
of our colleagues,
également à
I
remercier les
also want to
Canadiens
thank
de leurs
Canadians
efforts
for their
soutenus.
continuing
Il y a
efforts.
plus d'un an, lorsque les médecins
More than a
hygiénistes
year
en chef
ago,
vous ont
when
demandé
chief
de changer
medical
vos
officers
habitudes
called
de
for
vie au
massive
quotidien
change to
de
the everyday
manière
lives of
importante,
Canadians,
vous avez relevé les
you
défis
rose
et
to the
vous avez fait
challenge,
preuve de
and you have shown
persévérance, de
perseverance,
gentillesse et de
kindness, and
solidarité.
solidarity.
Même si nous traversons une période difficile en ce
Though
moment,
we are in a
nous
difficult
faisons des
stretch right
progrès.
now, we are
Les
making
mesures de
progress.
santé publique donnent des
Public health
résultats.
measures are having
Et
an
grâce
impact.
aux 13,1
And with
millions
over
et plus de doses de
13.1
vaccins
million
contre
doses
la
of COVID-19 vaccines
COVID-19
administered across
qui ont
Canada
été
to date,
administrés partout au pays et à l'approvisionnement en vaccins
and
qui est fait
vaccine
en plus
supply
grand nombre,
increasing,
nous allons connaître
we
des
will
jours
get
meilleurs.
to better days
Alors que
ahead.
vous continuez de prendre des précautions individuelles,
As you
que vous
continue
suivez les
with
conseils de
individual
santé publique,
precautions,
que
follow
vous vous
public
faites
health
vacciner
advice,
quand c'est
and get
votre tour,
vaccinated when your
n'arrêtez
turn
surtout pas
comes,
de faire
please
tout
don't
ce qu'il
stop
faut pour vous
doing all the
garder
other
en
things
santé.
that are vital for
Faites-vous
maintaining your health.
Faites-vous soigner immédiatement pour des
Seek
problèmes
immediate
de
care
santé
for
urgents
urgent
et
issues,
maintenez vos rendez-vous
and keep
médicaux
up with health
pour rester
visits
en santé
to maintain
physique et
physical
mentale.
and mental
Faites
health,
soigner les maladies chroniques
care for
et
chronic
prévenez les
diseases,
problèmes de
and
santé
prevent
au moyen de
future
dépistage
problems
et de la
by keeping
vaccination.
up to date with
Même
screening
après vous
and
vous êtes fait
vaccinations.
vacciner,
Even
il est
after you've
plus
received the
important
vaccine,
que jamais de continuer de
it
laver ses
remains
mains,
as
de
important as
garder une
ever
distance physique
to wash
des
your
autres
hands,
et de
maintain physical
porter le
distancing,
masque.
and wear masks.
Merci de rester
Thank
le
you
plus en
for
santé
staying as
possible.
healthy as you can.
Thank you, Dr. New. We'll now turn to the phones for questions. The Prime Minister will be around for a number of questions, and then the ministers and doctors will still be around afterwards for a amount of time. Operator, over to you.
Thank you, merci. Please press star 1 if you have a question. S'il vous plaît, appuyez sur étoile 1 si vous avez une question. La première question de Raymond Fillon, TVA. La parole est à vous.
Raymond Fillon from
Merci,
TVA.
bonjour, Monsieur le Premier ministre.
Good day. Thank you,
Il y a une
Prime Minister.
manifestation contre les mesures
There's been a
sanitaires qui est prévue
protest
demain
against
à
health
Montréal,
measures that is
On nous dit que ça va
going to happen
perturber
tomorrow
la
at this
vaccination au
Olympic
stade olympique.
Stadium.
Les rendez-vous ont dû être
Apparently, it will
déplacés.
be
J'aimerais avoir
an
votre
impediment to
réaction à ça.
vaccinations that are planned there. I'd like to hear what you have to say to that.
C'est profondément désolant
Answer.
de voir des gens
It is
réagir comme
really
ça. Je comprends
maddening to
que
see
c'est des moments
that people are
difficiles par
reacting in
lesquels nous
this
passons
way.
tous.
I
Il
realize
y a
that
beaucoup
these
d'anxiété,
are challenging
beaucoup
times.
de
There's a
frustration
lot of anxiety, a lot of
parmi nous
frustration
tous
that we're all
de
feeling
ces mesures de santé publique.
because of these public health
Mais ces
measures.
mesures sont là
But these public health
pour nous
measures
protéger,
are in place to
pour
protect
protéger
us,
nos travailleurs
to
de première
protect
ligne,
our
pour
frontline
protéger
workers,
nos
to
aînés, pour
protect our
protéger
seniors,
nos enfants,
to
pour
protect our
protéger notre
children,
communauté.
protect our
Et
communities.
nous devons de
And
continuer
we must
d'écouter nos
continue
experts en santé qui
to
nous
listen
disent
to our
que,
experts.
de se faire vacciner le plus
Our
rapidement
public health care
possible,
experts are
de
telling us to
continuer
get
à porter le
vaccinated as
masque,
quickly as possible.
d'éviter les
They're telling us we
rassemblements,
should continue
de
to wear
rester
masks.
chez eux
We
le
should
plus
avoid
possible.
any
C'est
group
la
gatherings.
façon
We should
qu'on
stay
va
home.
pouvoir
This is the way
revenir
for us to get back
à une normalité dans
to
nos vies de tous les jours le plus
normalcy in
rapidement
our daily
possible.
lives as soon as possible.
Malheureusement,
Unfortunately,
des gens qui se rassemblent pour manifester
people that are getting
sont en
together,
train de
gathering to
contribuer à la
protest, are
prolongation
actually
de ces mesures de santé
prolonging,
publique,
extending
des
the need for
mesures
these public health
restrictives dans
measures, these
lesquelles nous nous
restrictions
retrouvons
that we all
maintenant.
end up
Alors,
find
je
ourselves in
demanderai à
now.
tout le monde
So I would call
de
on
faire leur
everyone
part,
to
de
please do
faire
your part.
attention, de réduire
Please
les
be
contacts.
careful, reduce your
Et c'est
contacts.
comme ça qu'on va passer à
This is
travers.
how we will get through this crisis.
Pour revenir au Premier ministre de
Juste une
l'Ontario.
seconde, Raymond, ils m'ont demandé en anglais.
In English?
I think it is really troubling to see people continuing and intending to come together and demonstrate against these public health measures. Of course, freedom of speech and freedom of assembly and the ability to express your opinions continues to be extremely important, even and especially during a pandemic. But it must be done safely. The irony here is that by gathering, people are putting each other at risk, spreading further cases of COVID-19, and extending the time in which we will have to be faced with restrictions and public health measures. We know people are tired. We know people are frustrated. Everyone is feeling this way. But the better we are at hanging in there a few more weeks, at getting vaccinated quickly, at making sure we're continuing to avoid gatherings, keeping our contacts low, being careful, wearing a mask, using the COVID app, these are the things that are going to get us back to normal as quickly as possible. And I know that's what we all want.
Oui, en suivi, j'aimerais revenir, M. Trudeau, sur le Premier ministre de l'Ontario. Outre les étudiants étrangers, il vous a écrit hier pour vous demander d'instaurer une quarantaine obligatoire à l'hôtel pour les voyageurs qui entrent au pays par la frontière terrestre et aussi d'instaurer un test de dépistage obligatoire avant le départ pour les vols domestiques. Est-ce que l'un ou l'autre est dans vos plans?
On en a discuté hier soir de différentes mesures. D'abord, je peux dire, d'abord avant tout, nous allons continuer de travailler avec les provinces et territoires pour s'assurer qu'on est en train de protéger les Canadiens.
Protecting Canadians. Now, as to the issue of borders,
il y a un an, il y a plus
remember
qu'un
that
an,
over a year ago,
on a fermé
we
la
closed
quasi-totalité de nos frontières
basically
aux
all of
voyageurs.
our borders
C'est juste
to
les Canadiens,
travelers.
les
So
citoyens
only
permanents et
Canadians,
ceux qui
permanent
sont des
residents,
travailleurs
and
essentiels
essential
ou
workers
des cas d'exception
or
qui
exceptional
peuvent traverser.
cases
C'est
can
une
cross the
réduction
border.
de
So that's
à
a
peu près
reduction
jusqu'à
of about,
on est juste 5%
there's
des voyageurs
only
maintenant qui
5%
passent. Mais
of travelers
même
are
à ça,
actually
il fallait avoir des
getting
mesures
through the border
fermes
now.
et
Despite
on a
that,
des
we needed
mesures
strong, stringent measures.
quiconque arrive
So
à nos frontières,
we
que ce
have
soit
measures. So
par avion
anyone arriving to our border,
à nos frontières terrestres,
by plane
doivent démontrer
or
un un test de
at a
dépistage
land border.
en dedans de 3 jours
These individuals
négatif,
have
ils
to
doivent se faire
show
tester
a
à
negative test in
l'arrivée,
the last
ils
3
doivent
days.
se
They have to
rendre
be tested
immédiatement en
upon arrival.
quarantaine
They have to
pendant 2
immediately
semaines.
go
Ils vont se faire
go into
tester une
quarantine for 2
troisième
weeks. They
fois
will then
le
be
jour
tested a
8
third time
de
on day
cette
8
quarantaine.
of that
Et
quarantine.
ces mesures sont suivies de façon
These measures
attentive
are
par les
being
autorités avec
closely
des
monitored by
pénalités
the
extrêmement
authorities
salées
with
pour quiconque
extremely
ne
harsh
les suivra
penalties for
pas.
people who don't
Par rapport à la
comply.
différence
Now,
entre
as
quelqu'un
to
qui
the
arrive à une
difference
frontière
between a
terrestre,
person
même
arriving
en
at a
taxi
land
ou en
border, whether
limousine,
that be by
versus
taxi or
quelqu'un qui
limousine,
arrive
versus someone
par avion,
arriving
il faut
by
se souvenir,
plane,
Raymond,
you have to
qu'il
remember, Raymond,
y a une différence
that there
fondamentale.
is a fundamental
Que
difference
quiconque
there.
arrive à une
Anyone
frontière terrestre
arriving at a land
arrive
border
des États-Unis,
is arriving
s'est
from
fait
the United
tester dans les
States,
3
has
derniers
been
jours
tested
des
over the last 3
États-Unis
days by
et
the U.S.
est aux
and
États-Unis
is in the
depuis
U.S.
au
and
moins
has been in
2
the
semaines à
U.S.
cause de leurs mesures de quarantaine.
since at least 2
Alors,
weeks
c'est
because of their
différent de
own
quelqu'un qui
quarantine measures. So it's not
arrive
the same thing as
directement
someone arriving
d'un pays à
directly from an
l'international dans un de
international
nos aéroports. Et c'est pour
flight
ça qu'on
into
a
one of
plus
our
de mesures
airports, and
fermes.
this
Et
is why
on
we
est en
have
train de
more of these
aux
robust measures
aéroports.
in
Et on
place
est en train
at
de regarder
airports.
attentivement
And we are
les
closely
chiffres, les
looking
données, les
at, we're
résultats de tous ces
monitoring the
dépistages
figures, the
pour
results of all of
s'assurer
these tests
qu'effectivement, on
to
est en
make
train
sure that we
de
are
protéger les gens
indeed
le plus
protecting
possible. Mais
Canadians as
on
much
va
as
bien
possible.
sûr continuer à
Of course,
travailler
we will continue to
avec
work
les provinces.
with the provinces.
Par rapport aux voyages domestiques,
Now, with respect to domestic
le
travel,
premier ministre Ford a souligné
Premier
son
Ford
désir de voir plus de
expressed,
dépistage aux aéroports à travers le pays.
his
C'est des mesures
desire to
que,
have more
évidemment,
testing
les provinces
at land
peuvent
borders
instaurer
or between
eux-mêmes.
provinces.
On
These
a
are
vu,
measures
par
that provinces
exemple,
can
dans
impose
la bulle
themselves. We've
atlantique
seen
ou
with the
dans les
Atlantic
territoires
bubble or in the
de l'Arctique,
territories, the Arctic,
les autorités locales ont imposé
that
des
the
mesures
local
pour
authorities
restreindre
have
les déplacements
put
domestiques
in some
avec
measures
une
to
grande
restrict
efficacité.
domestic
Alors,
travel, and that's
l'Ontario
been
a
very
des mesures
effective.
qu'ils
Ontario
peuvent faire
does have
directement.
measures that
Mais
it
en
can take
plus, on a
itself.
offert de rendre
Above and beyond
disponibles
that,
des
we have
millions
offered to
de tests de
provide
dépistage
millions
rapides que
of
nous avons,
rapid
qui ne
tests
sont pas en train d'être
that we
utilisés
have that are not currently
au
being
maximum à
used
travers le pays
to full effect
pour
throughout the
faire,
country.
par exemple, du
For
dépistage
instance,
des gens qui arrivent
test
à
people
l'aéroport.
that are
Mais sur ça,
arriving at
ça
at these
serait
airports.
la province qui
But
devrait
even then, it would
mener
be
la
up
charge
to the
là-dessus, mais
province
on est
to
là pour
lead on
fournir
that. But we are
les tests de
prepared
dépistage
to
rapides. Alors,
provide these
nous
rapid
sommes là pour
tests.
être
So
partenaires
we are
à chaque
here
étape
to be
pour, et toujours
partners
ouverts
at
pour en
every
faire
step
plus.
of in every step of the process, and always open to doing more.
We will always be there to work with the provinces and territories to keep Canadians safe. I think that is something that we've demonstrated from the very beginning. And we had conversations around a range of issues that we could move forward on last night. I think one of the things to remember, first and foremost, on international travel and people arriving in Canada is it's been well over a year that we actually shut down over 95% of all travel to Canada. The only people traveling across our border in any way right now are either permanent citizens or Canadians returning home, essential workers, and a limited number of exception cases that have squashed the number down to 5% of what it used to be in previous years. On top of that, everyone arriving in the country needs to show up with a negative PCR test from the last 72 hours, gets tested on arrival, goes into a strict quarantine for 2 weeks in a secure quarantine location, usually their home, with significant follow-ups and checks, and has to do a third test on day 8 to ensure that they are negative. These are measures that apply to everyone. And one of the things to remember as well is there is a fundamental difference between someone arriving at our land border versus someone arriving at an airport. Someone who arrives at our land border has been in the United States, has a PCR test from the US, even if they traveled internationally before because of US quarantines, has been in the US at least 2 weeks. And therefore, the measures that we put in place at the border, and we're following very closely the numbers and the data we collect on these tests, has been a extremely low and manageable number of cases, and we're always looking at doing more enforcement and stepping up on the penalties on that, and we will continue to work with the provinces on that. But there is a fundamental difference between someone arriving on connecting flights from anywhere around the world at our airports, which is why we have required government-approved accommodations until the negative PCR test that they got on arrival is indeed furnished. But further than that, we will continue to work with the provinces, whether they want to look at rapid testing on arrival in airports across the country. We have we have in our possession millions upon millions of rapid tests that are being underutilized across the country, and would happily furnish some to Ontario or any other provinces that want to test people on arrival, but they will have to work out the logistics on how to actually test everyone. But it's something that has been done. We watched the Atlantic provinces severely limit domestic travel with very strong measures. We watched the Arctic territories doing the same thing to extreme success. And they didn't require the support or the intervention or the permission of the federal government to do it, although we were happy to support them in any ways we needed to. Ontario has lots of tools, and we will continue to work with them on bringing in the right tools to keep people safe through this difficult third wave.
Next question, operator.
Thank you, merci. The next question is from Dylan Robertson from the Winnipeg Free Press. Please go ahead.
Good morning, Prime Minister. The Manitoba Premier says teachers will soon be able to go down to North Dakota to get vaccinated and come back to Canada without quarantining. Are you comfortable with provinces sending essential workers to the States to get vaccinated? And do you support waiving the quarantine and testing requirements?
I believe conversations are still very much ongoing around waiving quarantine requirements. That's something that I think all Canadians have a little concern around. The initial desire to get people who were crossing the border already, like truck drivers and others, vaccinated in South Dakota didn't require any waiving of quarantines, but we are working to ensure that people get vaccinated right across the country as quickly as possible, and we'll continue those conversations with Manitoba and others.
Follow up, Don?
And Prime Minister, the premiers of Manitoba and Saskatchewan say they're relying on the generosity of Americans because Canada's vaccine rollout is going so much slower. And I'm wondering what your response is to that.
We have been working incredibly hard across the country and around the world to deliver on vaccines. We started our vaccination program in December, and it has ramped up steadily ever since. We had a goal of delivering 6 million vaccines by the end of March. We actually delivered over 9 million vaccines by the end of March, and we have now increased massively and rapidly the pace of vaccination, such that we'll be receiving close to 2 million vaccines this week, 2 million vaccines from Pfizer alone next week and for the subsequent weeks, with more shipments of Moderna and others also coming in. So we are in the full ramp-up phase of vaccinations. We've seen provinces across the country highlighting dates in which the general population down to 18 years old will be able to be vaccinated in the coming month. And we've also continued to demonstrate extraordinary efforts to get more vaccines in quicker to Canada. We're now looking at over 50 million doses of vaccines in the country by the end of June. And as we've said from the beginning, every Canadian who wants to get vaccinated will be able to be fully vaccinated by September. Getting vaccinated is how we get through this, and that's what we're going to continue to work on with all our partners across the country and around the world.
Thank you, and we'll take one more question on the phone. Operator?
La prochaine question de Catherine Lévesque, La Presse canadienne.
Catherine Lévesque from La Presse canadienne, Canadian Press.
Oui, bonjour, M. Trudeau.
Yes,
J'aimerais revenir
Trudeau.
sur le mandat qui a été confié à l'ex-juge Arbour hier concernant les inconduites sexuelles dans l'armée. Je me demandais, en fait, je voulais vous entendre à savoir pourquoi votre gouvernement va-t-il se pencher sur un fléau qui est déjà connu et qui a déjà fait l'objet d'un examen indépendant il y a déjà 6 ans.
There was an independent assessment that was already done 6 years ago, wasn't there?
Il y a 6 ans
Answer. The
donné des
report 6 years ago
recommandations,
provided
plusieurs desquelles
recommendations,
ont été
several of which
amenées en changement par le gouvernement.
several of which were
On sait
implemented by the
aussi
government.
qu'on a besoin de faire plus.
Several of these
La réalité,
recommendations.
c'est qu'il y a
Of course, we need
encore
to
trop
do
de
more.
femmes
The
et d'hommes
reality of the matter is that there are too
ne se
many
sentent
men
pas
and women,
appuyés quand
or
ils
women and
s'avancent
men who
avec
do not feel
des
supported
histoires, des
when
allégations, des expériences
they
inacceptables au sein de nos forces
share
armées.
their
Alors, nous devons
experiences
d'assurer qu'il y ait un
unacceptable
processus, un
conduct,
encadrement, un
and being at
environnement
the
dans
receiving end of that
lequel
within the armed forces.
quiconque
We need to create an environment. We need to make sure there's an environment
s'avancer
in
pour
the armed
partager
forces where
leur
anyone
expérience,
who wants to
va avoir les
share
ressources,
their
va
experience
être
will
appuyé
have
de la bonne
resources
façon.
and
Et
will
c'est
be
ça pour ces
supported in the right
changements
way.
immédiats, mais
So
aussi
that's
long
the case
terme,
for
parce
these
que c'est
immediate
pas facile,
changes,
ce
but
sera
also
pas
for
facile
the
de
long
changer
term. It
la
will not
culture
be
des forces armées.
easy
On a
to
besoin
change
de la juge
the
Arbour
culture
pour
within the armed forces.
amener
We need
ces
Justice Arbour
recommandations
to make
concrètes
these
pour
concrete
agir. Mais
recommendations
on ne va pas tout simplement
in order to
attendre
act.
à
But
la
we
fin
won't
de la rapport,
simply
du
wait
rapport de la juge Arbour.
the
On va agir, on est en train d'agir tout de
Justice's
suite
report,
avec
for this
le
report to come
général
through.
Carignan,
We are
qui
already
va
acting
être à la
with
tête
General
d'une
Carignan,
nouvelle
who will be
unité
heading a new
pour
unit
recevoir directement à partir de maintenant
as of today,
des plaintes,
directly
des
receive
expériences, des
complaints,
allégations
allegations,
qui pourraient
experiences
venir à l'avant.
that could
Nous
be
savons
brought
que nous
forward.
devons agir
We
concrètement
know
et
that we
c'est
need
exactement ce
to
que nous sommes en train de
take
faire.
concrete steps, and that's exactly what we're doing.
Oui, et je comprends tout ça, mais M. Trudeau,
Yes, I
mettez-vous à la
understand what
place
you're saying,
d'une
Mr.
victime
Trudeau, but
qui attend des actions concrètes.
imagine
Je comprends que là, il y a
if
certaines
you were a
actions qui ont déjà été
victim
prises, qui ont
waiting for
été
some concrete
en fait
action.
estimées
I understand
inadéquates par
that
Mme Deschamps d'ailleurs.
some of the
Mais là,
measures
je comprends
were
qu'il y a d'autres actions qui sont prises par Mme
inadequate
Carignan,
according
mais
to Mme
quand
Deschamps.
même,
There
vous allez
are
encore une fois
more
lancer
measures
une
that are being considered by Mme
consultation pour
Carignan.
éventuellement mettre en place un
There
examen
is some issue
indépendant.
about
Est-ce que vous comprenez que c'est frustrant
consultations
finalement
to
pour une
then
victime qui
have an
regarde le gouvernement
independent
fédéral qui
process
se
in place?
demande
But, you know,
quand est-ce
think
qu'on
of
va
the
avoir
victims.
un
They're
examen
looking at the
enfin qui
federal
est adéquat?
government and they're saying, when are we
Je
finally going to
comprends
have
entièrement que la
adequate
situation actuelle, le
examination of the
système
situation?
actuel
Answer,
est
I fully
inadéquat.
understand that the
Chaque
current
fois
system
qu'on
is
entend
inadequate. Every
des
time we
femmes, des
hear from a
survivantes, des
woman, a
victimes
survivor, a
s'avancer
victim,
pour partager
anytime
leurs
we hear that
expériences dans
these
les
individuals
médias
have
et de
shared their
façon anonyme,
experiences
c'est
in
parce
the media
qu'elles ne
or
se
and
sentent pas
anonymously, it's because these
appuyées,
victims do not feel
ressourcées,
supported. They do not feel
écoutées
they
à
are being
l'intérieur des
listened
systèmes
to
qui
within
existent
the current
actuellement
system
aux forces armées.
in the Canadian
C'est
Armed
pour ça
Forces.
qu'on a besoin
And this
de
is why
transformer cette
we need
culture de
to
façon sérieuse et profonde.
transform
Et
that
la
culture
juge Arbour
in depth.
va
And
nous
Justice
donner
Arbour
ses
will be providing
recommandations
her
pour le long terme
recommendations
et
for the
agir
long term
directement.
so
Mais
we
on
can act
n'attend
directly.
pas
But we're not waiting
le travail de la juge
for
Arbour.
Justice Arbour
On a
to
choisi
complete her
le
work. We
général
have
Carignan pour
picked
être
General
une
Carignan
personne qui, tout de suite,
so that we could have someone immediately who can provide support
ces
and
survivantes qui
reassure
voudraient
these
s'avancer
survivors
maintenant
who want
pour les
to step
entendre
forward right
et
now.
pour faire des suivis.
Make sure that these individuals are
Évidemment,
heard, make
dans
sure that
un an,
follow-ups are completed.
dépendamment des
And of
recommandations
course, in a year's
de
time,
la juge
depending
Arbour,
on the
on
recommendations
pourrait
from Justice Arbour,
augmenter ou
there could be an
modifier
increase
ou
or
ajouter au
a
mandat
change or
de la générale
amendment
Carignan, par
to the
exemple, mais
mandate that
on
General
ne va
Carignan
pas
has been given.
attendre pour
But
agir,
we
on
will not
agit
wait before we
maintenant.
act.
C'est
We are
ça
already acting
que toutes
now,
celles
and
et
that
ceux qui
is what
servent dans les forces armées
all
méritent.
Canadian Forces members deserve.
Or global national. I just want to pick up on that. You've had the Deschamps report for 6 years. One of the things that you can do right now is have that external review, which is what everybody's been asking for, but you've charged Justice Arbour with looking at that. So I'm trying to figure out what faith could victims have if you are just punting this down the road another 12 months when it's something you could have done today, you could have done 3 months ago, you could have done 5 years ago.
Over the past years, there have been many things done to counter the culture in the military, to provide better support to survivors, to anyone who comes forward with experiences or allegations of sexual misconduct or assault or harassment. We have brought in a number of measures. They have all been inadequate. Survivors continue to feel that they are not appropriately supported, continue to feel like the only thing they can do is either talk to the media or come forward anonymously. And that is a failing of the entire system. That is why we have tasked Madame Justice Arbour to work immediately to establish exactly what formalized, powerful processes are going to be adequate to provide proper support and to transform the culture of the military. But Mike, you're absolutely right. We should not have to wait a year before we can take action or provide support, and that is why we have appointed General Carignan, who will be there right now to be able to support and to take in and follow up on any allegations or experiences that survivors wish to come forward and share. And as Madame Arbour does her work and make recommendations, which don't necessarily have to wait till the end and the final report, we will be able to adjust and modify. We need to make sure that anyone who has experienced harassment, intimidation, assault, or any unacceptable actions in the force has the confidence that they will be heard and supported as they come forward. That has simply not been the case in the past many, many years, and that's why we were taking action today.
And just on a follow-up, I wanted to go back to Tuesday when you said that you and nobody around you knew that the allegations against General Vance were of a Me Too complaint. But an email from a senior bureaucrat at the time referenced allegations of sexual harassment. Elder Marquez said that his presumption was certainly that it could be of a sexual nature. So at the time when you heard of the complaint, as a feminist prime minister with a feminist government, why didn't you ask if it was a Me Too complaint?
As we've said many, many times, as a government, we have always taken extremely seriously the responsibility to support anyone who comes forward. And supporting in this situation meant ensuring that this complaint was followed up by the proper authorities with the mandate to do that. Not followed up on by politicians, but by a rigorous process. That is what my office ensured, that complaint was directed towards the appropriate authorities. Unfortunately, they were unable to move forward, but that process remains extremely important to ensure that we're following up on it. But as we've seen, these processes are inadequate, have not led survivors to feel like they can come forward and hold the alleged perpetrators to account. That is why we are moving forward on strengthening the systems with the work to be done by Justice Arbour and General Carignan.
Oui, bonjour, M. Trudeau. Laurence Martin, Radio-Canada. J'aimerais revenir sur cette demande du gouvernement Ford d'interdire l'accès au Canada aux étudiants étrangers. Est-ce que je dois comprendre que vous avez acquiescé à leur demande? Et si oui, quand? Est-ce que c'est à partir de maintenant? Est-ce que ça touche la prochaine rentrée scolaire? Est-ce que vous pouvez nous donner un peu plus de détails?
Oui, il y a plusieurs mois, on a travaillé avec les provinces et territoires sur la question des étudiants internationaux. Ce qu'on a établi comme système, c'est un système par lequel les provinces eux-mêmes allaient donner aux services frontaliers une liste d'institutions postsecondaires, pour la plupart, qui avaient des mesures adéquates pour pouvoir recevoir et assurer une quarantaine et un contrôle des étudiants internationaux. C'est la province eux-mêmes qui a soumis au gouvernement fédéral la liste de ces institutions pour que nous puissions permettre l'entrée de ces étudiants-là. Donc, c'est un système qui exigeait le travail, la participation, le partenariat entre le fédéral et la province. À travers le pays, ce n'est pas une demande qu'on a reçue d'arrêter complètement les voyageurs, les étudiants internationaux, parce qu'il y a bien des provinces qui considèrent qu'ils sont en train de bien les gérer et ce n'est
that they're doing a good job of managing these students, and that they're not a huge source of cases. But last night, Premier Ford told me that he wanted us to suspend the arrival of international students coming into Ontario. So for that to happen, Ontario just simply has to set out a list of Ontario institutions that no longer want to have exceptions for international travelers. My office is currently working with the Premier Ford's offices and the authorities in Ontario to do a follow-up to make sure that this approach is formalized. I heard it yesterday, but of course,
formel à faire et on est en train d'être là pour le faire si c'est effectivement quelque chose que le gouvernement de l'Ontario veut assurer. Ça, c'est une des questions qu'on regarderait avec eux, mais comme j'ai dit, les autres premiers ministres des provinces n'ont pas fait de demande maintenant, alors on va travailler directement avec le gouvernement de l'Ontario.
Prime Minister Tom Perry with CBC. Do you think that anything that the Ford government is asking for in terms of these increased measures at the border, these restrictions on international students, do you think they're going to have much impact on the spread of COVID-19 in Ontario and in other parts of the country?
We know that importation through the borders is extremely low in terms of cases in the country. It's not zero, but we also know that at the borders, there are series of tests. There is a mandatory enforced 2-week quarantine that has been effective in controlling the importation of cases and making them not the primary vector for new cases in this country. We are happy to continue to talk about strengthening the measures moving forward, and we will continue those conversations with all provincial premiers. But at the same time, we have seen that this third wave is very much around community transmission, and that's why we're sending supports. We're there with more contact tracers, with more rapid tests for enhanced screening. We're delivering vaccines. We're there to support the provinces as necessary while we're going through this third wave. We all have our roles to play, and we're playing them as fully as we can, but we need to stay focused on crushing this third wave and getting through to a much better summer. Nous allons toujours être là pour travailler avec les provinces pour limiter l'importation des cas.
The arrival of cases through the border, the
closure of
our borders for over almost a year now, except for few exceptions, has been an extremely effective way of limiting COVID-19 cases in our country. We're always open to doing more, and we will work with the provinces on new measures.
En même temps, on reconnaît que
of course, at the same time, we recognize that this third wave is characterized by community spread, and that is where we are also very much present to help the provinces with PCR testing, rapid testing, vaccines, healthcare workers, the Canadian Armed Forces, the Red Cross. We will always be there to support the provinces while they manage this third wave.
Prime Minister, Chris Nashkate, CTV National News. Ontario has said they are willing to pay for a $500 increase to the Canada Sickness Benefit for all Ontarians, but they've asked that your government help administer the program through the already existing system. You've said you will always help a province with requests during the pandemic, so why hasn't the federal government approved the Ontario proposal? Has there been any progress on this following your recent call with Ford?
The best sick leave, the best sick pay, is the one that you can wake up in the morning feeling like you have symptoms that are problematic. You can pick up the phone and call your employer and say, I'm not coming in today, and know that it's a sick day that you will continue to be paid for. That's not something that the federal government can deliver, with the exception of federally regulated industries. A couple of years ago now, the federal government moved forward so that employers in federally regulated industries could offer exactly that kind of sick leave. in provincially regulated industries, which is the vast majority of workplaces across the country, a number of provinces have moved forward and territories have moved forward already with employer-driven sick leave. And the supports are also there for those employers with the wage subsidy, for example, which can be used, the federal wage subsidy, which can be used to support workers who are off sick. But it is the provinces and territories who are able to work with employers to mandate that kind of sick leave. In the fall, we brought forward measures on a 2 weeks, which we later extended to 4 weeks, $500 sick leave that people could apply for directly. And that, of course, would be most effective for gig workers like Uber drivers or others who don't necessarily have a direct employer that can grant them sick leave, and that money will be there for them. But yes, it is a less efficient and immediate process to get people sick leave than to go directly through the employer. But we continue to be there for people. We are happy to look at how we can help, and I can say that Minister Freeland has been engaged in this conversation with the premiers on this, and I can turn to you, Chrystia, for further reflections on sick care, the sick leave.
Yeah, thank you, Prime Minister. Look, the only things that I would add to what the Prime Minister has said is maybe emphasize the wage subsidy point. I think it's important for employers to understand that they can continue to claim the wage subsidy if they are paying wages of an employee who is off sick, and they can claim the wage subsidy for the employee that they've had to bring on maybe to do the work that that person who is sick isn't doing. So that's just to be sure that people are clear about that. And the reason I emphasize that is, as the Prime Minister has said, for people, for someone who is working, the best, fastest, most confidence building way to feel you can do the right thing and stay home when you are sick is just to know that you're going to continue to be paid your salary. That's the thing that's going to give people the most confidence. And the people who can do that obviously are your employers. And so that's why we really think, you know, the way to help Canadians do the right thing, especially low-wage Canadians who may be worried if they lose that couple of days' income, they're not going to be able to pay their rent or buy their groceries. The best way to help people do the right thing is for employers to keep on paying their workers when they are sick. That's why, as the Prime Minister said, for federally regulated industries, a couple of years ago, we put in place 3 days of mandated sick leave. It's good to see provinces moving in that direction, and the wage subsidy is there to offer additional support.
Hi, Stephanie Taylor with the Canadian Press. You said in earlier remarks that the U.S. requires people to quarantine for some period of time and that they're not transiting to Canada that way, but that's false. We know people, Canadians, are diverting flights to the United States and then crossing the border, circumventing Canada's hotel quarantine program. The U.S. has no mandatory quarantine order. So why are you saying this isn't happening, and what is your government going to do to immediately crack down on this?
Canadians who are returning from Florida or Arizona and landing in Buffalo or Bellingham are doing so by showing a U.S. PCR test. They are internal American travelers. Anyone transiting into an airport from into the U.S. from overseas needs to go through the U.S. arrival processes and land in the U.S. before leaving the airport and eventually driving to Canada, where they will need to show a Canadian a U.S. PCR test. So there is a difference between people traveling from the U.S. through a land border versus people landing directly from Europe or Asia or elsewhere in our airports.
Thank you. That concludes the time the Prime Minister has. We'll go back to the phone for questions once he leaves for a couple of questions for the ministers and doctors.
Thank you, merci. The next question is from Tonda McCharles from the Toronto Star. Please go ahead. Tonda McCharles, your line is open.
Darn, sorry, I was muted again. Hi, thanks. Minister Freeland, can I go back to the top-up issue? The Ontario government seems to be under the clear impression that this is still an open debate with you and that this is still on the table, that you are still entertaining their request and for the federal government to allow top-up benefits under your program to go to Ontario workers and they would reimburse you. So I really want to understand, is that door clearly shut? Can you please tell us, have you shut that down?
Okay, now it's my turn to unmute myself. Hi, Tonda, nice to hear you. Look, I think the Prime Minister was pretty clear, and it's an answer in two parts. The first part is to say we moved when COVID first hit to provide support that filled in the gaps of Canada's EI system. You know, when COVID first hit, we realized our system didn't cover everybody, particularly gig workers. And we realized we needed to be there and provide additional support. And that support does include, as people know, an additional sickness benefit. It's there to help people do the right thing. But we're also very conscious of the fact that gap-filling support that the federal government has put in place can never help people as immediately and can never give people as much certainty and confidence as just continuing to get paid by your regular employer if you have one, which gig workers often may not, hence the need for that system. But there's nothing that beats just continuing to get your salary. And that really can give people the comfort to do the right thing and stay home when they are sick. That's why when it comes to federally regulated industries, we have the 3 paid sick days. That is why I really do want to emphasize to employers using the wage subsidy that is there to provide additional support. And that's why we really welcome steps taken by provinces and territories to either mandate and support employers who are providing that support.
Follow up, Tony?
Right. And, you know, thanks. I have a pea-sized brain at the best of times here. So I do understand all that, but I still don't hear no. And they don't hear no because they tell us that they hear there are still talks going on. We're still discussing. So can you please tell us, is that off the table?
Tonda, you very much do not have a pea-sized brain. Your protestations to the contrary, and I know you understand the issue very well. I'm just going to reiterate that from our perspective, and I think that this is a widely shared view, by far the best thing to do is to support employers in maintaining the salaries that people are paid, being sure that people can do the right thing, take a day off sick, and not feel they're going to hurt their own financial situation. I'd like to take this opportunity to say to employers, please do that. It's the right thing for your community. But, you know, also it's the right thing for your workplace. It's not good for anyone to have people who are sick at any time, but especially while we're fighting a third wave, come into work. And we welcome the fact that provinces and territories have been acting in that space. We are glad to provide the gap-filling support that the federal government has been providing from the start. But, to reiterate, the thing that is going to help us right now, as we are at the height of this virulent third wave, is to ensure that people can just keep getting paid. People who have a salary can keep getting paid their salary.
Merci. Prochaine question. Operator.
Thank you. Merci. The next question is from Cormac McSweeney from City News. Please go ahead.
Yeah, my question is going to be for Minister Anand. We're hearing from Pfizer that apparently they're going to start sourcing our COVID-19 doses beginning next week from the United States instead of Belgium. Can you confirm that, and can you tell us what that might mean for our deliveries moving forward? Does it help logistically speed things up at all? And where are the talks right now with the United States when it comes to the AstraZeneca vaccine? Because we've purchased 20 million doses. They're not using it. They're willing to give some away, and we still haven't been able to access the doses we've already paid for.
Hi, Cormac. Yes, I can confirm that as of May 3rd, the Canadian supply of the Pfizer-BioNTech vaccine will come from its manufacturing site in Kalamazoo, Michigan. And in terms of the context for our discussions and negotiations, from the outset, our contract and Health Canada's authorization of the Pfizer vaccine have allowed for deliveries from both the PERS Belgium and the Kalamazoo, Michigan sites. This provides the supplier with the flexibility to ship vaccines from both locations of production and Canada to receive those shipments seamlessly. Pfizer has informed us that they will be shipping Canada's doses from Kalamazoo beginning next week. We expect to remain on the same delivery schedule, with 2 million doses expected each week in May, starting next week, and 2.4 million doses each week in June. The supplier, Pfizer, has also confirmed that shipments will continue to go directly to the provinces on the same schedule. In terms of the U.S. discussions, those have continued to be ongoing this week. And we are being very aggressive, especially with the supplier, in terms of reiterating and stressing the importance of having AstraZeneca vaccines under our bilateral APA in the country as soon as possible. We will have about 4 million, more than 4 million AstraZeneca vaccines in this country from a variety of locations prior to the end of June. Thank you.
Follow-up,
And as a follow-up on a different topic for the Deputy Prime Minister, the Prime Minister spoke at length about the border measures currently in place, kind of defending them, saying they're working. But I'm hoping for a little bit more clarity here when it comes to the push from provinces, specifically Ontario, that we bring in this 3-day hotel quarantine for people crossing that land. Can you clearly say, yes, you're considering it, or no, that is not on the table?
So look, on the border measures, let me start by underscoring a couple of things the Prime Minister said. He did remind us all that Canada has very restrictive border measures in place, among the most restrictive, probably in fact the most restrictive in the G7. I think that's a good thing, but it's important for us to all be mindful of that. The Prime Minister also said, and this was discussed on the First Minister's call last night, that the federal government is very prepared to work with provinces and territories on specific views that, the situation in each province and territory is different. And I will tell you that premiers have different views on what's the right thing for them right now. And the federal government, we get that. We get that Canada is vast and diverse, and we are very prepared to work with provinces and territories on specifically what they need. As the Prime Minister said, when it comes to Ontario, that includes working with Ontario at their request at restricting the entry of international students to Ontario institutions. When it comes to other additional measures, look, our government is constantly reviewing all the measures when it comes to the fight against coronavirus, whether it is sick leave, as just discussed, or the border measures. You've seen that we acted on flights from India. So we're constantly reviewing those, very much in discussion with the provinces and territories.
Thank you. That concludes the time the ministers have. The doctors will be around for a number of questions still, although they have a hard stop in about 10 minutes. So we'll go back to the room.
Oui, Laurence Martin de Radio-Canada. My question is for Dr. Tam or Dr. New regarding these Canadian travelers who are crossing the border by foot and therefore avoiding staying in a quarantine hotel for 3 days. Do you think that this poses a threat to public health in this country at this point?
Maybe I will start, Ms. Theresa Tam. So I think that we're in the middle of a third wave and significant community transmission within Canada. So I still think that a massive focus should be on dampening that third wave through what's happening in our communities across this, primarily the 6 biggest provinces, but also others, while the vaccines are rolling out. So then when it comes to border measures, I think a couple of points for the land border, and I think the Prime Minister may have said this, is that of course the numbers of travelers have been considerably reduced. Even so, of course, exempt travelers that are delivering essential services have to get through. For others, so if there's a test, obviously, that is required before people come back into Canada. If you transited through the United States, you have to have a test before you come through. So if you're looking at public health risks, we want to see that they, reducing as much risk as possible at that land border. So if you don't have a test and you're not Canadian, you get turned back. If you're Canadian, you can get fined. So that is a key tool that can be used if people are not following rules. Then I think, it's a matter of reviewing a safe plan to get into a safe place for quarantine. And I do think certainly at the land border, depending on where you are, you may get tested at the land border, or you get your quarantine plan reviewed. And if you can get yourself straight home and you have a good quarantine plan, and you're doing your post-arrival test, that should mitigate a public health risk. So that's different layers of measures are being put in at the land border as well.
Dr. New, maybe I just to emphasize the point that Dr. Tam made, that yes, of course, there seems to be a lot of interest and almost, I would say, préoccupation avec nos frontières. But at the end of the day, if you look at the actual risk in terms of importation, the actual number of cases with respect to people crossing the border compared to what's happening in the communities in many of the hardest hit provinces, I think that's where the public health focus has to be. I think we need to be laser focused on 2 main things for community transmission in Canada. It's keeping up with the public health measures and vaccinate as many Canadians as quickly as possible. That's it. Simple.
En français, Monsieur New, la dernière partie, là, sur le.
In French, Mr. New, for the last part.
OK. En français, je pense que oui, c'est toujours une question. On peut regarder qu'est-ce qui se passe avec nos frontières, mais si on regarde le reste, vraiment, l'enjeu le plus important maintenant, c'est la transmission communautaire au sein de notre pays, dans toutes les provinces et territoires. C'est simple, les 2 priorités, c'est continuer avec les mesures de santé publique,
extend or continue with those public health measures, not give up, and also take individual precautions. At the same time, we continue to deploy vaccines to vaccinate the largest number of Canadians as soon as possible. It's as simple as that.
It's Tom Perry from CBC. I just want to follow up on that. I know this may not be the biggest source of infections, but is there an argument to be made for putting stricter measures at the border to keep more cases out, particularly these variants that are developing around the world?
Yes, Teresa Tam. So as the ministers, Prime Minister said, we have added a lot of different layers of measures. The borders will never be 100% proof on a virus that has the characteristics of COVID-19. So I think all the different layers, every single layer of testing and the quarantine, 14 days of quarantine is our basic foundation, and that remains so. So yes, I think it's important to try and slow down any introduction as much as we can. But even if you slow down things at the border, you still need the next stages, which is, any variants can be squished, if you like, and flattened in terms of its activity if the public health measures are in place domestically as well. We need the whole system to work together on that front. And so that I think remains a fundamental foundation of how we're managing this pandemic right now.
Yeah, Dr. New, I would just add a couple of points as well. Is that you're right. Certainly, as Dr. Tam mentioned, there's multiple layers of protection, and we're doing certainly, what I think is reasonable, in terms of risk mitigation. Having the pre-arrival test PCR before you come to Canada, another test on arrival, another one a day 8, the obligatory 14-day quarantine. I think really, if you look at what's going on, especially in the 6 provinces west of the Atlantic, especially, it's really an issue of community transmission. What we understand at the federal level is that the tried and true basic, public health control measures, be able to sort of isolate all of the cases, do the contact tracing, the testing, doing the appropriate management of contacts. Is a challenge. I think it's probably not happening as well to the point that public health officials want to do it. And then, of course, you get the spillover effect in terms of what's happening with the healthcare system, with hospitalization and then so on and so forth. So I think really that's where the focus really needs to be from a public health perspective. Let's control our community transmission. Let's get to the point that the public health officials can get back to doing the standard public health measures that we've been talking about, sort of the rapid testing and detection of cases, the isolation, the quarantine of contacts, the contact tracing. And then, of course, hopefully, then it won't have an impact on our healthcare system as well. So let's focus on that. And of course, as I said, vaccinating as many Canadians as rapidly as possible. That I think are the two mainstays that we should be pushing forward or on. And of course, there's certain things we can do at the border, but I think in some ways, I think it's detracting from what I think the primary focus should be from a public health perspective. Thank you.
Hi, Dr. Tam, Stephanie Taylor with the Canadian Press. There's been a number of reports lately of younger people dying from COVID-19. Is this evidence to you that younger folks are in fact more vulnerable or at risk from variants of concern, or is Canada still in a position where we're not sure on that?
So people keep sort of discussing variants. The virus keeps changing. It's an ongoing event. And so as the virus is adapting to the human population, I think the first thing that we're seeing is that some of them are more transmissible, so they spread easier. And as a result, reaches many more people, resulting in, even if they're rare events, becoming more frequent. So I do think that is a key aspect of why we're seeing more younger individuals from getting into hospitals, so that even rare events can be more common. There are some information, particularly on the B117 variant from the United Kingdom, also from Ontario, which suggests that there are stronger evidence towards the fact that they may cause more severe outcomes. So that might be added on top of the fact that you just got essentially more people infected. And so both of those factors might be at play. For some of the other variants, it's less clear. But it's something that must be constantly reviewed. I think the severity element is worth tracking, but mostly at this point, there are two things that are really important to track: is transmissibility, which I think all viruses are going to become more transmissible over time, and that we should treat every virus with respect, because that's what's going on in Canada, is that most viruses that you encounter now have a higher transmissibility, but we can do something about it in the same measures. In terms of the other elements that we are watching even more is any escape from natural or vaccine immunity. And so far, you know, the B117, the predominant variant in Canada, seem to be covered well from the vaccines, even if it has a little bit of reduction in coverage. The other variants still need more data, but there are some concerns, at least in the lab, that the current vaccines may not cover them as well. But still, the vaccines will provide protection, and I think they seem to be very effective at protecting against severe outcomes, the kind of things that you're talking about, which is hospitalizations, ICU visits. And so I think the bottom line is that as the vaccine supply goes up, that is really key for people of any age. Thank you.
Dr. Tam Creason with CTV. NACI has said that they prefer mRNA COVID-19 vaccines due to the excellent protection they provide. Do you agree with this assessment? And my other quick question, many scientists are now saying that COVID is spread by aerosol and not by respiratory droplets, as public health has consistently said. Is COVID-19 primarily an airborne virus?
So I think we've said, as the science evolved, that COVID-19 can be spread by both droplets and aerosols. Aerosols meaning smaller things that come out of infected persons, coughing, talking, shouting, singing, that you can breathe in. So I think that that's what the evolution in understanding has brought us. That is something that does occur with COVID-19. And so that's really important. The very specific aspects of contributions from every mode of transmission, I think, is still a topic of study. But I think the bottom line is we need to respect the fact that this virus can be transmitted by aerosols, and mostly when someone is in close range with someone else. So one of the analogies I know Dr. News talked about is imagining cigarette smoke. Closer you are to someone who's actually smoking, you're going to be inhaling more of that. So all those layers of measures, the 3 C's, close, crowded environments, poorly distanced with people not in your household, is a high-risk sort of situation. So the similar applications of those measures are very important. But one thing that I think is becoming increasingly important is actually the role of ventilation, given the potential for aerosol spread. And therefore, going outside is a safer place, much safer. And then we have actually provided, through expert advice, some guidance on ventilation for different settings published on our website.
Thank you.
It's Dr. New. Maybe I'll answer the first part about the mRNA vaccines. And so, yes, certainly our NACI is a independent committee of experts, and they've looked at all of the vaccines available in Canada that have been authorized for use, and they've made an assessment based on the data the way they see it. But I would say that of the vaccines that are authorized, there are 4 vaccines authorized in Canada. They've all been shown to be very effective against preventing severe illness and death. And I think the provinces and territories recognize that. And certainly in many parts of the country with the third wave, I think the challenge right now is to vaccinate as many people as quickly as possible to protect them against sort of the transmission of the COVID-19 virus going around. And so what we're hearing from our counterparts in provinces, territories, give us the doses. We want to keep vaccinating as many people as quickly as possible. So I think that's what we're focused on. And certainly the provinces, territories, they have NACI's recommendations. They'll look at them and they'll sort of take that into consideration as they roll out the vaccination programs for their respective populations. Thank you.
Thank you, Dr. New. And that concludes today's press conference.